have 1 minute left.
Ready.
Both you and your partner ready? All your equipment is good?
Good.
All right. You'll have 15 minutes for this assessment. Your partner can perform any task that you delegate to them. Your time will start after I read your dispatch information. Do you have any questions?
No, sir.
You respond to the base RV camp for a 76-year-old female with chest pain.
BSI is my scene safe.
Yes.
My number of patients is 1. My nature of illness is chest pain. I will have additional resources on standby. I would consider C-spine but not take it at this time. I see a female sitting in the tripod position, so my general impression of my patient is poor. Hi ma'am, my name is Sergeant Harvey. This is my partner, Sergeant Dean from MEDC EMS. Can we help you?
Yes, please help.
Okay, I'm gonna have my partner go ahead and obtain a baseline set of vital signs on you while I ask you some questions. Can you tell me your name?
Tyrell.
Can you tell me what time it is?
Afternoon.
Can you tell me where we are?
At the RV camp.
Can you tell me what happened?
I don't know, my chest hurts.
Your chest hurts. My patient is A&O times 4. It sounds like your chief complaint today is that your chest is hurting. Do you have any other symptoms?
Just my chest.
Okay. My patient's airway is open, clear, and secure because she's talking to me. Based off of my general impression, I'm gonna treat my patient for shock and make her a high priority for transport and transport immediately. Keep you nice and warm, ma'am. All right, can you tell me what you were doing when your chest pain started?
I was eating a burger.
Eating a burger. Does anything make it worse or better?
Nothing.
Nothing, okay. Can you describe the symptoms for me?
It's getting harder to breathe and feels like an elephant is sitting on my chest.
Feels like an elephant, okay. Does your pain move anywhere or does it stay in one spot?
It's just in my chest.
Okay. On a scale of 0 to 10, 10 being the worst pain that you've ever felt, can you tell me how bad it is?
10, this is the worst I've ever felt.
Okay. And about how long has this been going on?
5 minutes before I called.
Okay. Do you have any allergies that you know of?
No allergies.
Do you take any medications, over-the-counter vitamins or supplements as needed or daily?
Just nitro.
Nitro. Do you have any past medical history related to the reason you called us?
I have hypertension and angina.
Do you remember the last thing you ate or drank and when?
I had In-N-Out last night for dinner.
Last night.
Yes, ma'am.
Okay. Anything out of the ordinary happened today, or were you exerting yourself at all?
I was fine until this started.
Okay. Have you specifically done anything to make it feel better?
Took a nap 20 minutes ago.
Took a nap and nothing, and it didn't help at all?
No.
Okay. Have you been recently ill?
No.
Okay, and have you had any cardiac history of like an AMI or any heart surgeries?
None.
None? Okay, I'm gonna assess your pulmonary system. I'm gonna note the position that my patient is sitting in, her effort to breathe, as well as expose the chest that will show any injuries that could compromise breathing. I'm also gonna auscultate lung sounds, make clavicular, mid-axillary, bilaterally, and posteriorly.
The lung sounds are clear in all quadrants, no injuries noted.
Okay, I'm also gonna assess her cardio system, checking for any pain that radiates to the neck, jaw, arm, or DCAT BTLS, which is deformities, contusions, abrasions, punctures, penetrations, tenderness, lacerations, or swelling. I will also assess the neck for JVD and her ankles and feet for any pedal edema.
Ankle edema is present.
Okay. If you want to go ahead and tell him your vital signs so we can get our scenario vitals.
On the piece of paper right there.
Go. What vitals do you want?
Blood pressure 118/72, pulse 78, respirations 12, eyes pearl, SPL 298, skin pink, warm, dry.
Okay, can I get a blood glucose if indicated?
Blood glucose is not indicated.
Okay.
You're breathing on your patient. is 24, labored with an SpO2 of 94%. Your pulse is 126, thready. Your skin is pale, cool, diaphoretic. Your blood pressure is 166 over 110. Your eyes are pearl.
Alright, based off of the vital signs with an SpO2 of 94 and her complaints of chest pain, we're going to go ahead and put her on a high flow oxygen with an NRV at 15 liters per minute. My field impression is that my patient is suffering from acute coronary syndrome. I'm going to contact medical control and ask for permission to help administer another dose of her nitroglycerin.
Permission granted.
Okay. I will check the medication for drug dose, patient, route, and time. I will ask my patient if they have taken any erectile dysfunction medications, any previous doses of their nitro, or any other vasodilatory medications. I will also have my patient lie supine to prevent fainting. I'll take one tablet, administer it under my patient's tongue, and allow it to dissolve, asking them not to chew or swallow.
Medications administered.
All right, after 5 minutes, I will reassess my patient's vital signs.
Are you ready for your vitals?
Yes.
Your blood pressure is 122 over 84. Your pulse is 96 and thready. Respirations are 20 and normal. Eyes are pearl. Skin is pale, cool, dry. And your SpO2 is 98% on high flow oxygen.
All right, how are you feeling?
I feel like the elephant is being lifted off my chest.
Wonderful. All right, we're going ahead and gonna get you to the hospital. En route, we will reassess her vitals, interventions, primary and secondary assessment every 5 minutes, and I'm ready to give my verbal report.
All right.
Okay, we arrived to the scene of a 76-year-old female complaining of chest pain. She was ANO times 4. She had a burger last night. As far as her onset, nothing makes it worse or better. She describes it as hard to breathe in an elephant sitting on her chest. No pain radiation. She said it's a 10 out of 10 and it's been going on 5 minutes prior to our arrival. She is prescribed nitroglycerin for her history of hypertension and angina. She had in and out last night for her last oral intake. Nothing out of the ordinary before we arrived. She tried to take a nap and the pain did not get any better. She does not have any previous cardiac history of an AMI or surgeries. Upon her pulmonary assessment, her lung sounds were clear. For cardio, she had ankle edema present. For her baseline vital signs, blood glucose not indicated, blood pressure was 166 over 110, pulse was 126 and thready, respirations were 24 and labored, eyes were pearl, skin was pale, cool, and diaphoretic, and SpO2 was 94%. Based off of the vitals and her chest pain, we gave her an NRV at 15 liters per minute. We assessed that she was having acute coronary syndrome, contacted medical control in order to administer a dose of her nitroglycerin. 5 minutes after administration, her vital signs were blood pressure 122 over 84, pulse was 96 and thready, respirations were 20 and normal, eyes were pearl, skin was pale, cool, and dry, SpO2 was 98%, and she said that she had felt the weight lifted off of her chest. And I'm done.